With how quickly we're seeing the Omicron variant spread, we're checking in with Dr. Timothy Quinn on how to gather safely with family this holiday. Dr. Quinn, good morning.
Hey, good morning, Nick.
Dr. Quinn, let's jump right into this. Let's talk about testing. A lot of places are still open to get tested. Would you advise a negative test before heading to a family gathering?
Well, Nick, I'm wearing my celebration holiday hat, just trying to raise a little optimism today. But we have to understand that we're not out of the storm. I mean, this Omicron variant, I compare it to the Grinch trying to steal Christmas, and it's something that we really need to take seriously. Now, as far as getting tested, what getting tested does is it allows you to decrease your risk of infecting your family, your loved ones, going to those family gatherings. So it is being advised by myself and even the CDC to, if you can gain access, get tested before going to your family event, because you don't want to spread coronavirus to maybe a vulnerable grandmother or aunt that might lose their life.
Now, I have a lot of older family members, and I think I've shared with you before, my family lives here in the area. I am vaccinated. I am boosted. I have tested negative for the virus. Do I still need to wear a mask around my family members?
Well, as I said in the beginning statement, it's all about risk. And it's going to be impossible to have zero risk of bringing coronavirus into the home of an older family member, somebody with chronic medical conditions, someone that's vulnerable. So anything that we can do to decrease those risks, I highly advise it. And it's being advised by the entire medical community. I mean, the problem with Omicron, it's in a lot of cases, your symptoms are very mild. So you might have a little runny nose, and then a lot of people have no symptoms at all, including those that are fully vaccinated and boosted. So wearing that mask, that gives you that extra layer of protection, and anything we can do for our family, we should do.
We've also heard some conversation around size of gatherings. Do you have any information around that about, hey, Nick, 3 people or less is the best way to go, or no, bring the whole family in?
Right. And I looked at a lot of reports this past evening, and there's no commitment to a specific size or number of people, but they did provide some advice. For instance, if you go to a holiday gathering, individuals from the same household can maybe have assigned seats and sit together, because when you're eating, you can't wear that mask. And that way you'll decrease the exposure to people from other households. Wearing the mask when not eating, getting tested before going. If you have symptoms, don't go get evaluated by your medical provider and make sure you're safe. And just all of these different mitigations can be very helpful going to that family event.
Dr. Quinn, I wish I'd known you were going to wear your hat. I would have worn mine, because I do actually have one of those hats. But I do have one more quick topic I want to touch on with you. The CDC is updating its guidance for healthcare workers in preparation for a possible surge in Omicron cases. Now, it says that asymptomatic healthcare workers with COVID-19 can return to work after 7 days with negative tests. That window can also be shortened if there are staffing issues. What is the proper window for potential spread now? It used to be 2 weeks. Is this risky?
Well, it is risky. And as I keep reiterating, decreasing risk, that's the number one priority, but also to look at the real world situation. You have a hospital, a clinic, such as our clinic, and you have people out, which we actually have one of our providers out right now. And if you don't have the manpower in the clinic, people are coming in or into the emergency rooms. You have people with coronavirus or even car accidents or heart attacks or strokes. And if you don't have the medical personnel there to treat them, people are losing their lives again. So the CDC and all the other organizations that are coming with these guidelines, they're taking all of this into consideration, but they're also studying the raw data. And the data is a little encouraging in regards to how long a person is infectious. But know that these decisions are well thought out, but patient safety is the number one priority, as well as just looking at the whole real world situation.
And Dr. Quinn, just to reiterate what you said earlier, I want to make sure I'm clear. Even those who are buying these at-home tests, don't use that as the only barometer to stay safe. You're saying use that as only a small piece of the safety puzzle, correct?
That is correct, because if you do the test, number one, did you do it perfectly? It's impossible to be perfect. There are a lot of false negatives, meaning that maybe the test said negative, but you're positive. Maybe it was too early in the disease infection. So it's a good idea to do everything you can. Wear the mask, social distance as much as possible. Try not to mix households when you can. Congregate outside if it's not too cold. Open windows, ventilation. anything you can do to decrease those risks, to not bring that gift of coronavirus to your grandmother or your aunt, I highly advise it. It is highly being advised by the entire medical community.
Well, Dr. Quinn, thank you so much for joining us this morning. Happy holidays to you and your family.
Hey, happy holidays to you all as well.